Hi friends, this is Dr. Vivek Sasindran and welcome to yet another episode of our ENT Talks. In today's episode, I would be discussing about a very commonly asked question in ENT practice. So whenever we have patients who come to us with ear discharge and we suggest a surgical option, many a times the question raised is, should we get this surgery done? What if the surgery is not performed? What are the consequences? So the most common clinical condition where you have persistent ear discharge or recurrent ear discharge is something called as chronic otitis media, and this topic has been discussed in detail in our previous videos. Now what happens in majority of these patients is that there would be a perforation in the tympanic membrane or the eardrum, due to which the patient continues to have persistent ear discharge. And as a result, the patient also will have associated hearing loss. Now one should understand that the permanent treatment for this particular medical condition is a surgical procedure by the name Tympanoplasty, wherein we attempt to repair the tympanic membrane or graft the tympanic membrane, or in simpler terms, we reconstruct the tympanic membrane. And this also helps us in regaining the hearing loss or recovering the hearing loss. However, for those patients who are skeptical about surgery or who are scared of undergoing a surgery, what happens is over a period of time, because of persistent discharge, the hearing levels also tend to decline. And what happens in the long run is that the hearing loss progressively worsens. What happens is that the tiny bones in the middle ear also get eroded because of recurrent or persistent infection. So the hearing outcomes are much better if the hearing loss is minimal. So early surgery should be the aim, because we are able to give the patients almost a near normal hearing. The use of medications like the ear drops, which are commonly used for ear discharge, is only a temporary solution for this problem. Thank you.